Our next EKG pattern is the posterior MI. Since there is no EKG lead that directly reflects posterior electrical forces, we can utilize alternative views called reciprocal leads. Lead V1, shown here, is the sole lead that we utilize for a posterior MI diagnosis. This is not a direct view of the posterior side, but rather V1 mirrors perfectly the posterior portion of the heart. Note the posterior portion of the heart and the inclusion of a portion of the posterior descending and distal right coronary arteries, shown here. On the EKG, we see lead V1. Let's look at the characteristics of this V1 and note the unusually large R wave. Remember, we discussed the amplitude and the positive deflection. That's a rather large R wave in V1, and it is abnormal. The large R wave is the reciprocal of the posterior Q wave, and an upright T wave is abnormal as well. These are the two clinical signs for EKG of a posterior MI. It is missed quite often. So, when examining 12-lead EKGs and the patient has signs of myocardial infarction, be sure to always look at that sole lead, V1. If it meets the criteria, be highly suspicious of a posterior MI. Posterior MI is not one of the more common findings in myocardial infarction. However, it is important to know 12-lead EKG components, and it just may save a life. Let's look at this example of a real EKG. Inferior leads 2, 3, and AVF. Lateral leads 1, AVL, V5, and V6. Septal V1, V2, and anterior V3 and V4. Do you notice any significant ischemic changes? Let's see how you did. In this example, of course, you see significant ST segment elevation in the inferior leads. This is an acute inferior MI, 2, 3, AVF, with ST segment elevation in all leads, but particularly in 3 and AVF of the contiguous leads. Note the ST segment elevation. Next, since we're talking about posterior MIs, this is a very large posterior MI with extension. Note the upright T wave, which is abnormal for V1, and a very tall, high amplitude R wave of the Q-R-S complex. This is significant for acute inferior wall MI with posterior extension.